wanasema ati SHA stands for Somali Health Authority. If you look at the list that was released yesterday of the SHA county managers of the 47 counties, the majority wametoka the Somali community, and then wakatake president, and then the other communities, hadi nini wale mulito wapumbafu, mumetupu kwa the others, scrambling for remains. Let me tell you something. What has happened in the Trump administration, wamefunga zile mifereji zao za Minnesota, is the same thing that is happening in the SHA scandal. And we will see it play out itself. And that is why they're even deploying their people. Ndio sasa wakuje vizuri sana and a fake SHA payment. And then siphon our money ahead of the 2027 election. This is why the Minister of Health has refused to publish SHA payment data. Publishing it to the audit. We want to see these hospitals and we want to see where these monies have been going.
Something doesn't add up. Billions are being deducted from Kenyans every month under the Social Health Authority. Yet hospitals are broke, doctors are striking, and patients are being turned away. When Kenyans ask for SHA payment data, the government refuses. And behind that silence, disturbing allegations have emerged of powerful business cartels, politically protected vendors, and Somali-linked corporate networks accused of sitting at the heart of the SHA system. This is not about tribe. This is about who controls the money and who is being sacrificed. The success gap. Despite the noble intent, 2025 and early 2026 have seen massive systemic failures. Many hospitals have turned patients away because SHA owes them billions in unpaid claims, an inherited debt of over 30 billion from NHIF. Higher costs for workers. The flat-rate NHIF model was replaced by a 2.75% gross salary deduction. For middle-class earners, this is a significantly higher monthly cost for benefits that many feel are currently inferior to what they had before. SHA is not just a health program. It is a massive financial pipeline involving ICT system providers, payment processing companies, insurance intermediaries, data management vendors. This is where the problem begins. Instead of the government directly managing everything, critical parts of SHA were outsourced, quietly, urgently, and with limited public scrutiny. And in those shadows, cartels thrive. Let's be very clear. The issue is a small, extremely powerful class of businessmen, some of whom operate cross-border companies, use proxy directors, win repeated government tenders, enjoy political protection. Several SHA-linked ICT, fintech and insurance support companies have been publicly linked by whistleblowers and analysts to Somali-owned or Somali-connected business networks. The same networks that have historically dominated government ICT systems, digital payment infrastructure, emergency procurement contracts. These companies allegedly control SHA data systems, handle transaction flows, sit between hospitals and government payments, meaning they see the money before hospitals do. If SHA payment data were released, Kenyans would see which vendors are paid first, which hospitals are delayed, how much goes to system maintenance, who controls the digital backbone. And that is exactly what certain interests cannot allow, because transparency would expose inflated contracts, overpriced ICT systems, duplicate vendors, possible revenue skimming. This is why SHA data is classified, not for national security, but cartel security. Meanwhile, cancer patients are turned away. Mothers are told to buy their own medicine. Doctors strike. Nurses work without pay. Hospitals say SHA has not paid us. So, Where is the money if SHA is collecting perfectly, but failing to pay hospitals? Then someone in the middle is benefiting. That is not incompetence. That is extraction. If the government is serious, release SHA collections per month, vendor payment schedules, all ICT and fintech contracts, names of intermediary companies. No spin, no excuses, because healthcare money should never be secret. This scandal will not be solved by blaming tribes. It will only be solved by following the money. Until SHA data is public, every Kenyan has the right to ask, who is eating while we are dying? Let's check out what netizens are saying in the comment section.